welcome. Thank you for joining us in our discussion on promoting food security and health equity through medically tailored meals. I'm Carrie Stoltzfus. I'm the Executive Director here at Food and Friends. We're hosting this discussion this morning, and I just want to start by introducing our amazing panel. Our moderator today is Tonia Wellons. Tonia is the president and CEO of the Greater Washington Community Foundation, which is the largest public foundation in our region. The foundation makes grants of $60 million annually, and Tonia has led several key initiatives at the foundation, including Voices DMV, the Resilience Fund, and the Partnership to End Homelessness. Prior to joining the Community Foundation, Tonia was an Obama administration appointee as head of global partnerships at the Peace Corps, where she was responsible for leading the Corps' relationships with other federal agencies, the private sector, international NGOs, and donors. Christopher King is the chair of Georgetown University's Department of Health Management. He's also an associate professor and board certified in healthcare management. Christopher recently authored a report on health disparities in the Black community, an imperative for racial equity in the District of Columbia that I encourage all of you to read. Prior to joining Georgetown, Chris was Assistant Vice President of Community Health at MedStar Health, a $6 billion healthcare system comprised of 10 hospitals in the Baltimore, Washington region. Chris is also a commissioner for DC's Commission on Health Equity, where he assesses practices and shapes the formation of policies that apply a health equity lens in cross-sector decision-making in our city. Radha Muthiah is the president and CEO of the Capital Area Food Bank, which distributes 45 million meals a year to over 400,000 people across the metropolitan region. Given the scale of the food bank's operations, Radha and the food bank have been leaders in our city's response to the COVID epidemic. Prior to her role at the food bank, Radha was CEO of the Global Alliance for Clean Cook Stoves, a public-private partnership hosted by the United Nations Foundation that improves livelihoods, empowers women, and protects the environment through creating a market for clean household cooking solutions. And again, I'm Carrie Stoltzfus, the Executive Director at Food and Friends, where I've had the pleasure of working in multiple capacities for the past 17 years, and I've been the Executive Director for the last 2 years. Food and Friends was founded as an AIDS-serving organization in 1988. We began also serving cancer patients in the year 2000, and in my years in leadership here, I've expanded our services to include those living with a number of other illnesses that affect one's nutrition and one's ability to prepare food, such as diabetes, heart failure, and kidney failure. I've also strengthened our relationships with healthcare providers and insurance providers in our region. So Tonia, I'm going to turn it over to you.
Great. Thank you, Carrie, for those kind introductions, and thank you to everyone for joining us today. As you've just heard, we have a lineup of excellent panelists to discuss health equity, food security, and unique community-based interventions like medically tailored meals. We'll tackle the issues from a few different angles, like how does illness and health fall into the broader patterns of food insecurity that we see or are experiencing in our region? How does food access behave as a social determinant of health and create gaps in healthcare outcomes? And lastly, how are community organizations like those represented on our panel today working with healthcare institutions to solve for systemic issues? And what should we consider in terms of partnerships and investments for the future? So we'll reserve about 15 minutes at the end of the discussion for Q&A. And we welcome your engagement in the chat box, so feel free to drop your comments there. If you have questions, please use the Zoom feature, the Q&A feature for your questions, and we'll get to as many as we possibly can. A recording of this discussion will be available in short order. So now I'd like to turn to our panelists and ask them to just share a bit about who you are and the work that you're doing. Radha, can we start with you?
Great, thanks Tonia, and thanks Carrie for inviting me to participate on the panel. So I have the privilege of leading the Capital Area Food Bank. Carrie mentioned earlier, we're leading the effort in our region to provide food to those who need it, and we've been doing so for about 40 years. And obviously over the last 6 months have been focused very much on responding to the pandemic. A few things that I'll highlight there. One statistic is just that there's been a tremendous growth in food insecurity in our area, and we certainly worry about how people are going to get their food just to satisfy, hunger today. But we want to do so in a manner that supports their nutritional needs and supports healthy outcomes. So I think it's really terrific that we're talking about this link and the nexus between food and health as both are critically important and both can influence one another. At the food bank, we do believe that food is medicine and good food is essential for healthy, productive lives. And food is therefore also an equity issue. We can see just across our region, in a 10-mile radius, if you will, those who don't have access to good quality food are seeing a life expectancy that's 30 years less than those who do have adequate access to food and other basic support services. So there's no question that the availability, access to good, nutritious food makes a difference, not just to satisfy hunger today, but also to ensure strong, healthy outcomes in the future.
Great. Thanks, Radha. Dr. King?
Sure. Thank you, Tonia. And it's such a pleasure to be with you this morning. I'm Christopher King, and as Carrie mentioned earlier, I'm the chair of the Department of Health Systems Administration at Georgetown University. And my research and scholarship and practice is really around how do we create equitable systems of care in the healthcare delivery system, right, that have the capacity to meet the whole needs of the patient. And that requires us to do work, some heavy lifting around bridging the gap between what we all know as healthcare and public health. So my work is around reimagining the typical American's healthcare experience. What does that look like as we recognize that the majority of our health is shaped by what's happening outside of the walls of the healthcare institution? But the healthcare institution has a role to play in facilitating an improved community when it comes to strengthening and ensuring that communities have the infrastructure for healthy living. So I've been privileged over the years to have regular conversations with thousands and thousands of people about their healthcare experiences. And through those conversations, food insecurity is always one that's at the top. If we're going to improve the health of the nation, it's time for us to really recognize the importance of healthy diets, access to affordable foods, and the healthcare delivery system needs to be restructured in a way that reflects that. And so I am proud to be here on this panel to share a little bit about what's happening in the healthcare space. What does the future of healthcare look like? What's the potential? And how can we have a healthier region for the individuals that we're serving?
Great, thanks, Dr. King. I look forward to exploring more about the future of the healthcare experience in the conversation ahead. Carrie, I know you did open us up, but do you want to still give us a bit of opening remarks?
Yeah, sure. I'd like to say a little bit about what medically tailored meals are and a little bit about the scale at which Food and Friends operates. We cover the greater metropolitan region. In the coming year, we're going to deliver about 1.2 million meals to about 3,800 people across our region. And we intervene at the point in a person's life when they're really not able to do it on their own anymore. They're experiencing, serious and complex health issues, which have a lot of nutritional and dietary ramifications. Oftentimes, they're struggling to prepare food for themselves and their families. And we are providing food for them that is individually designed to meet their specific healthcare needs. And they also have the benefit of a registered dietitian who's really their friend in the battle to maintain their health and to fight their illness, and who's working with them to give them the best tools possible to manage their illness at home. We have 11 different meal plans that we offer that we can also combine to meet those needs of the individual. And we also provide food for the family, for the household. We know that the sick person is not going to be the person to eat the food if their kids are also in need. And there's also something really powerful about the whole family sitting down to the same meal. So that's been an important part of our intervention since the beginning, is really addressing this from the household level.
Great, thanks, Carrie. So Radha, I want to turn back to you. I know that the Capital Area Food Bank very recently released its hunger report. Would you mind sort of painting a picture for us around what the needs are and what the data says about our region?
Sure, no, happy to. So we released this hunger report late summer, midsummer this year, and we sort of intentionally did it after the first few months of COVID. Initially, it was supposed to come out in March, but we realized at that point that things were rapidly changing. So what we have seen are a few things. One is we were an area that had about 400,000 food insecure individuals prior to COVID. And when I speak about an area, it's really the greater Washington area. So all of the district, Prince George's and Montgomery County, as well as the counties in Northern Virginia. That number has since grown significantly to about 600,000 plus food insecure individuals. So just in the course of 6 to 7 months, that has gone up by about 50%. And those numbers are still variable, if you will, given that we're looking to see, this is highly driven by the unemployment rate, the poverty rate, and those are still unfolding. And unfortunately, given the news that there's not going to be the next stimulus package, until after the election, we know that there were many who are counting on either greater unemployment insurance or stimulus. So those numbers could change yet again in terms of those who are struggling to put food on the table. So that's the big picture perspective on the statistics. I think what's also interesting in the report is while every single zip code in our region had food insecure individuals prior to the pandemic, it's only intensified after and during this pandemic. Interestingly, the counties that have seen the greatest growth in food insecurity are Fairfax County and Montgomery County. Not exactly the counties we would have, randomly picked, if you will, given where food insecurity was. And this gets to this issue of unemployment being a huge driver and the fact that so many individuals in these counties were making ends meet before the pandemic, living paycheck to paycheck, but making ends meet. But not having a paycheck for several weeks or several months, it's certainly a slippery slope in terms of, getting them to a state of food insecurity. It also highlights the great inequities. I mean, that's really what runs through the report. If it wasn't called the hunger report, it would have to be the inequity report of the greater Washington region, because it shows so clearly and so painfully, how immigrants, people of color, women-led households, and youth are disproportionately affected by COVID and the economic downturn. They were already these equity gaps before, but they've just been exacerbated even further as a result of the pandemic.
Thanks, Radha. I think that's a pretty useful lead in to the next question, which I'll direct to Dr. King about the social determinants of health. And I wonder if you wouldn't mind sharing sort of what are the social determinants of health and how do they affect individual health outcomes, sort of linked to some of the data that Radha just shared.
Sure. So these social factors or social determinants, social correlates, you'll see different naming in the literature. But it really speaks to the fact that health is mostly shaped by where we live, work, eat, and play. Mm-hmm. So if you look at what contributes to the health of an individual or a population over time, the clinical care that's received represents about 10-20%. The remainder is based on where we live, where we eat, where we play. What does the community look like? Do we have access to jobs with livable wages, not minimum wages, but livable wages? Do we have access to high quality education? Do we have access to affordable, healthy food, right? And so when we have communities that don't have that infrastructure or that capacity, you're going to see it play out in people's health. And it's something that needs to be considered. And as we think about health care, I always tell the students that I work with, we've done a really good job in this country providing medical care, right? Making sure that there's the evidence around when you get your preventative services and getting the medications you need and having access to providers. That's great medical care. But have we cracked the code on healthcare, right? Are we delivering healthcare? If we're delivering healthcare, we're recognizing recognizing that the medical piece is just a part of the big picture, right? And so what does our healthcare experience look like? Is it just medically focused, or is it holistic? And do we have the strategic partnerships that are necessary to ensure that people have access to the resources that are needed in real time? And that's what partnerships like those with Capital Area Food Bank and Food and Friends can look like, right? It's strategic partnerships working at the community level to ensure that those social factors, in this case, we're talking about food, are met, right? So if you have a patient who is diabetic, obviously that individual has a diet that's going to be very important to preventing the condition from getting worse. And so if that individual is going home to an empty refrigerator, right? Or if that individual has to take medication that should be taken on a full stomach, and they don't do that, right? They take it on an empty stomach, that just makes things worse. Mm-hmm. And so it's important for us to recognize, and I love the title, food is medicine, right? That food is just as important as a prescription. And we need to really change our mental model and shift in that way and really respect the power of food as a healing agent and preventing, a healing agent in helping folks manage their conditions, and also an agent of prevention to prevent the development of chronic disease conditions.
Great, thank you. So Carrie, in the context of food is medicine, how are medically tailored meals unique as a food insecurity or health inequity intervention?
Yeah, definitely. I'll use diabetes as an example since Chris raised that. I spoke at the beginning about our ability to individually tailor the meals to the unique needs of that individual. So someone who is living with diabetes, part of their management of that disease is monitoring their blood sugars. And so our diabetic diet is designed to be very high in fiber and high in fruits and vegetables, whole fruits and vegetables, with little to no added sugars. Fiber is a natural buffer to glucose in your bloodstream. And the dietitians will also work with our clients to counsel them about the timing and the amount of carbohydrates that they eat throughout the day to keep that consistent. All of the carbohydrates that we do send out are whole grain, again, because they need to be high fiber. So we're helping them avoid spikes in blood sugars that will actually, predispose them over time to all of the complications that come along with diabetes, amputations, heart failure, kidney failure, etc. So it really is an opportunity to intervene at the point that we get to meet this person and start providing them the tools to better manage their illness.
Great, thank you, Carrie. I want to shift the conversation just a bit, and I think Radha teed this up appropriately to talk about some of the racial and health inequities linked to food and food insecurity. Dr. King, I'll come back to you just to have you talk about a report that you really recently published on health inequity in the district. Would you mind just sharing us some of the things that you found?
Sure. So the title of the report is Health Disparities in the Black Community. And so we look specifically at Black residents in the District of Columbia. And the second piece of the title is An Imperative for Racial Equity in the District of Columbia. And so when we say racial equity, I just want to be sure that I define that. If we're talking about racial equity in health, we're talking about when a person's race or population, the race of a population, is not a predictor of health, right? So that is when we achieve racial equity, when we don't predict or we can't predict a health outcome by race. And so what we looked at, we looked at data, and so it's a mixed method approach. So we looked at the empirical data, and then we talked to people about what's happening in the district. And what we found was, the number of Black residents with diabetes is 7 times higher than white residents. Black residents are more likely to die from heart disease at a rate that's 2.5 times higher. Black residents who die from colorectal cancer, 3 times higher. Black residents who are obese, 3 times higher. We also looked at these social factors, Tonia, those social determinants, compared to with all the racial and ethnic groups, the median household for Blacks is lowest, almost 3 times less than whites. The number, $43,000 per year, Black residents versus $135,000 per year, white residents. Again, that's the median household income. Housing cost burden, defined as when an individual is spending more than 30% of their income on housing expenses. And so we know that approximately 50% of renters have a high housing cost burden. So you can infer that if folks are struggling with just paying their mortgage or rent, well, in this case, their rent, then there may be some challenges in obtaining healthy foods. We also know that when we did the report, approximately 11% of district residents were food insecure, but we recently learned that it's increased up to approximately 20% due to what's happening right now with COVID. And we project that it'll just get worse as we continue to feel the pain from COVID infection. So the report also outlines some recommendations, right? And one of the recommendations is what we're talking about today, strategic partnerships, and how important it is for healthcare organizations, one, to apply a racial equity lens, recognizing that these issues are real. Systemic racism is real. It exists in the District of Columbia. We are all a part of a system that has been designed a certain way that does not allow everyone to have equal access to opportunity. And so how do we correct that, right? And so we lay out some recommendations for how to do that for not only the healthcare delivery system, but the broader ecosystem from our government to the private sector. And so that's the contribution that this report has made to the district. And you know, being in academia, it's important that we're grooming the next generation of leaders who understand these dynamics and can operationalize how to undo, I call it undoing the damage that's been done for the past 400 years. So.
Thanks, Dr. King. You know, I'm curious, Radha, and I'd love to hear from you and Carrie about, you know, sort of given the backdrop of some of the data that has been presented, some of which was pre-COVID. Some of this, we know that many of the pre-existing inequities existed well before COVID. How are we thinking about expanding access, Radha, and the notion of partnership? So I'd love to hear from both you and Carrie about, you know, ideas and options for expanding access, and how are you working collaboratively?
Sure. Yeah, no, thank you for that question. And I think a few things that Dr. King said, which I just want to reiterate very quickly. It's different medical care and healthcare. I so appreciate you highlighting the differences there, because it's so critical for people to first understand that, and then to figure out where we fit in that full value chain of providing healthcare. It's clear where the medical establishment fits, but I think less clear to many where other NGOs and government bodies fit. And so one nature of partnerships that you asked, Tonia, you know, is in relation to where the rest of us fit in that continuum. And I think that's where, you know, food actors, you know, Food and Friends, ourselves as the food bank in DC Greens as well, are all part of this, you know, Food as Medicine Coalition. And we play very important sort of upstream and downstream roles. So upstream for us as the largest provider of food, if we're not providing healthy food, then immediately you've got a large problem, you know, along that continuum. So we track our wellness foods. We're always providing at least 80% of what we consider wellness foods. So high fiber, low sodium, you know, low sugar. And about 35 to 40% of what we provide is fresh produce. So that's a given now. It wasn't a given many years ago, but it's a given. And that's so important, because that's the flow of food that is going into all of those who are low income and food insecure. So that's the upstream. On the downstream side, you know, we're looking to help provide the right types of food for those going through different stages you know, of managing illness, etc. Food and Friends does a very specific and important role, you know, within that continuum for managing disease. But one partnership I'd like to highlight is our partnership with Food and Friends, you know, in terms of being able to provide the right kind of food, you know, for them to be able to then prepare their meals to help others, you know, who are managing illnesses. That's one type. Another very different type of partnership is with Children's Hospital and the various you know, clinics, if you will, that are throughout our region. We have partnered with them for a few years now, and one of the areas of the partnership is where they have a two sets of questions. That's their food insecurity screener as patients come to Children's. They ask those two questions, and you can determine if the child and therefore the family might be food insecure. Those numbers vary considerably across the different children's locations, with high numbers in Columbia Heights, in Anacostia, Big Chair, and the Arc. They were already approaching 15 to 20% pre-pandemic. We just got some information this week that the Columbia Heights area, the food insecurity rate for their patients is now 75%. That's an unbelievable increase over this period of time. So with that type of data, they're able to share that with us. We're talking to them about having a food pharmacy that's located on site. So as a doctor or nurse determines that a family and a child is food insecure, before they leave that clinic and that medical center, they're able to go get good, healthy food. And the doctor could write a prescription, just like they would write a medical prescription. But it says, you know, need to eat more greens, these types of things, need to have more milk, need to have more protein, you know, and therefore they present that prescription and at the food pharmacy that we would have, and they're able to get what they need. So it's just an example of, you know, one type of partnership with Food and Friends, another one with Children's. And I think it's important as we get more data around these partnerships. You know, I know there are many healthcare providers and insurance folks, you know, on this call as well. There's a very interesting partnership that Carrie already has with so many of you, and that we think that we can all have collectively, so that we all play the role that we need to play to ensure that we're preventing as much of, you know, illness and disease as possible, as opposed to the way it's been in the past, where we're focused much more on the curing side, you know, after it's occurred.
Thanks. Thank you, Carrie. You want to talk about partnerships?
Yeah, definitely. So, you know, just to build on what Radha said, I really do think partnerships between community-based organizations are really important. This is a really large, really complex problem, and it really does take all of us working together. And in a lot of ways, I see the work that the food bank does and Food and Friends does as puzzle pieces that fit together. You know, the work that Radha has done to really you know, increase the nutrition of the food that the food bank provides in a lot of ways is, you know, by introducing healthier foods into the system at a broader scale, you know, that might prevent someone from getting to the point in their illness where they need Food and Friends. So we're absolutely partners in that regard. You know, we also partner with healthcare organizations. That's how clients come to Food and Friends, is through a referral from their provider. So we're having conversations with them all the time, just to let them know who we are, you know, how to refer. We try to make that process as easy as possible. We've also been partnering with health payers. We've got a relationship with all of the managed care organizations in DC right now, whereby they'll refer their highest need members to us. So that's just another opportunity for someone to get access to Food and Friends. Their insurance is paying for them to receive healthy food at home. And they're seeing reductions in cost and better health outcomes, more satisfied members that want to stay with that plan. And that's part of the system, you know, of partnerships as well. And then lastly, you know, partnering with, we've got a partnership with Georgetown, whereby first-year medical students will come to Food and Friends, learn about nutrition, prepare this food, and then actually go out and do deliveries and see the neighborhoods where their future patients are living, and you know, just to learn more about what other people's lives are like, and that makes them better future clinicians. So there's really unlimited opportunities for us to partner, because like I said, it is a lot of work. So, but the partnerships are the really the good part, the encouraging part in tackling these issues.
Great, thank you. So before we transition to the section where we're going to talk about the future, I really wondered, Carrie, if you wouldn't mind just talking a bit more about what the research is telling us about the impact of medically tailored meals. Yeah.
Yeah, definitely. I mean, I really think what the research shows is that food insecurity is a patient safety issue. There was a study that came out a few years ago that I think about a lot that was looking at diabetic patients in California. And at least at that point in California, benefits, everybody got their benefits on the first of the month, you know, SNAP, unemployment, etc. So people got their benefits the first week of the month. By the fourth week of the month, hospital admissions for hypoglycemia had skyrocketed. So they had run out of food and they're still taking their medication to lower their blood sugar, and they end up being hospitalized. So that was true for the low-income diabetics. That wasn't true for the high-income diabetics. So food insecurity was making diabetes more dangerous for these patients. And that's a pretty heavy thing to think about. There's been a lot of great research that's come out in the past few years from other agencies that are providing medically tailored meals across the country, you know, showing a 30% reduction in overall healthcare costs. You know, inequity is expensive for all of us to bear. You know, a 28% reduction in hospitalizations. People want to be at home with their families. They don't want to be in the hospital. And also, you know, another one that I think that really stands out is a 50% increase in medication adherence. So we deliver food. We don't, you know, we don't deliver medication, but just by having that support of having what you need, people are more able to access their medication, to take their medication. Taking away one of those burdens helps them deal with, you know, other things that they're facing at the same time.
I appreciate that. Dr. King, can medically tailored meals play a role in addressing disparities?
Oh, absolutely. Absolutely. So I'm glad that you, Carrie, mentioned the numbers and the expense associated with what's going on in healthcare. This country, we're spending $3.6 trillion on healthcare. That represents approximately 18% of our GDP and approximately 11,000 per capita. That's a lot, right? When you look at what we're spending compared to other our peer countries, we really are an anomaly. We're doing something wrong. You know, we're not in the right space right now. And so this is a big piece of what needs to be done, right? So a few years ago, Robert Wood Johnson, the foundation, commissioned a group of experts, and their charge was to look at these social factors, Tonia, look at the social factors that drive health and identify the ones that you think would be the most impactful if we included them in the electronic health record, right? Food insecurity was one of the indicators. And so if we are including, if we're assessing patients for food insecurity, and again, if we have the resources in place to address the need in real time, if we can provide medically tailored meals to individuals who need them in real time, we will make a significant improvement in caring for patients with chronic disease conditions, as well as preventing the onset of chronic disease conditions. And so I'm glad that the word safety has come up. You know, the Institute for Healthcare Improvement a few years ago laid out the triple aim. You know, this country needs to reduce healthcare costs, improve the patient experience, and advance the health of populations, right? And so when we start to normalize food insecurity or food security, depending on how you look at it, as a routine part of the healthcare infrastructure, we will address each one of those prongs that will be key for improving the health of communities and the health of the nation. And we have to also remember, this also has an economic impact because we want people to be healthy and out in the world and giving us their best selves, right? And making a contribution. And so we want productivity. And so when we have folks who are ill and just don't have these very basic needs, it's a hindrance, right? It's a quality of life issue for the individual. Issues for the community emerge, and it's higher for us because we all end up paying for it as taxpayers, right? And so it just makes sense to invest on the front end and go upstream and do the work that we're doing right now.
Yeah, you know, I so appreciate this conversation, because when we've been thinking about food insecurity, particularly in COVID, we're thinking about it at kind of the sort of the macro level for our region. You know, Radha, you know, we've been working in partnership on the fundraising side and making sure that resources get to the food bank, but we're thinking about just, you know, troves of food getting out into community. And this conversation really takes it down almost to like the individual level, which is something I appreciate. And I imagine that as we're thinking about what the future of healthcare will be, that this is an important part of it. And I want us to shift the conversation there, particularly given the immense amount of challenges that we know are before us based on what the data says. How can we begin to sort of reimagine healthcare and reimagine food security as an important component as we're thinking about partnerships for the future, investments for the future, et cetera. Radha, can you kick us off here?
Yeah, sure. No, happy to. And so a few different ways. I think one, we have to look at, when we're looking at health and we're looking at inequity, we've got to look at the access gap. And we've talked a lot about that already. And I think this is where we're looking at investments that need to be made, both large as well as small. So when you look at the district and you look at Ward 7 and 8, and I know many of us do work there, you see still significant inequity. So from a food perspective, one full service grocery store in Ward 8, 80,000 people who live in Ward 8, doesn't make any sense, you know, given the ratios that we see in other parts of our region. So there've got to be many innovative ways to be able to get full service groceries, healthy groceries to neighborhoods, you know, where people are in need. So one example here is something that we have called Curbside Groceries. And so this is, you know, it's a grocery store that comes to you. And what's been most interesting here is that the number one and number two sellers on that store, if you will, are produce items, vegetables, fruit, dairy, protein. Only after that do you get to kind of the healthy snacks and things like that, you know. So that's really interesting, because it busts one important myth that has persisted for a long time, that people who live in low-income neighborhoods are not interested in healthy food. And we can see here immediately that that's not the case. The issue was access. It's difficult when you have to take 2 buses and a metro, and it takes time to get there. But if it's closer to you, that's what people are choosing. So we need to collectively come up with other innovative ways. And it doesn't need to be big business, so to speak. It can be small, medium entrepreneurs that are set up for success. And part of what we're doing through the Curbside Grocery Program is to show that something at a small scale, with, you know, relative to a large grocery store, if you will, you know, can function, can serve the needs of a community, and provide some bottom line financial impact for the investor. So this is something that we're running for a few years, and then we hope to be able to spin it off to entrepreneurs who want to take it and run forward with that. So I think we need to think more about these types of blended finance, public-private partnership types of innovations that achieve the social impact as well as sustainability for those who are running them. So that's one piece. What's interesting about that is we have had interest from insurance companies and healthcare providers to engage with us, you know, on curbside as well, because there's a clear benefit if people are having access to and eating healthy foods. You know, we are going to see less incidences, you know, of illness, et cetera. So everything we've spoken about in the form of prevention. So I think there's an interesting partnership to be developed there once this pilot, you know, gets to a slightly further stage of engagement. I do think, you know, what Carrie is doing, you know, for the medically tailored meals and having those reimbursed by insurance companies is absolutely the way to go. And I think as we work on, you know, a stroke pilot with George Washington University right now, you know, for those, it seems like people are getting stroke at younger and younger ages now, which is horrible. And so the issue now is how can you prevent that onset or prevent a second onset? And does healthy eating have a role to play? So there's a pilot that we're engaging there with Cigna, amongst others, you know, to be able to understand and learn, so that we can look at potentially, you know, having healthy food be something that's reimbursed, you know, so that it can prevent the illness and the major claims and costs, not just to the health system, but to all of us as well, you know, down the road. So I think there are these types of very different ways that, that do involve impact investors, NGOs who know the community, healthcare providers coming together to really develop solutions that are lasting. And I think that's one point I just want to emphasize. We don't want to, as an NGO community, I think, continually come up with projects that are highly dependent on, on donor funds. Donor funds are critical in the beginning to get something off the ground, but we want it to be sustainable. And ultimately, these are good businesses, truly good businesses, because there's an impact financially, but there's also an impact, from a social perspective and a community perspective. And that's important. As Dr. King highlighted, we have to view everything from an economic perspective as well. And only then will it be sustainable for it to be continued. So you don't have 2 years of better health outcomes, and then a donor drops off and, you don't have the ability to continue it. So I think thinking about these types of things and approaches are important for us as we look to the future. Absolutely.
Thank you, Radha. Innovative solutions, blended finance, tech-based, expanding access through text-based solutions, all things that I think are important in helping us to envision or reimagine the future of healthcare. Dr. King, do you want to offer your thoughts about the future?
Sure, absolutely. So I do want to name drop a health system that is nationally recognized for the great work they're doing around food insecurity, and it's ProMedica Health in Ohio. They are really, really a game changer when it comes to incorporating food insecurity in clinical systems of care. So I would recommend just taking a look at their work. I think about the Affordable Care Act right now, because I think most people associate the Affordable Care Act with Medicaid expansion and pre-existing conditions. There's so much more in that legislation that has really pushed the healthcare delivery system to do better, right? We're focused on value-based care over volume-based care. Let me give you one example that illustrates promise and what has really stimulated change: readmissions. So we know that for some conditions, when a patient has a procedure and that patient is discharged, if that patient ends up back in the hospital within 30 days, then the hospital does not get paid for the services that were needed. And food insecurity or not having the appropriate nutrition at home could be one of those factors that contributes to that readmission. Well, we don't want that, right? And so this is causing healthcare leaders to rethink how discharge planning looks, right? And are we really assessing what's happening in the home environment before we let this patient go, and making sure the patient understands, the instructions, the dietary needs, because if not, they could end up back in our facility and we suffer the penalty. That's just one example, right, of how we are being challenged as a healthcare provider to rethink models of care with a more holistic focus. And so that's just a sneak peek, I think, into the future. And again, that's just one example. The electronic health record and the ability to incorporate these social factors into the EHR. And as I said earlier, link patients to community-based organizations that can meet their needs in real time is key. But what's going to be important is that we have a payment model that supports those partnerships. Mm-hmm. That's a gap. And I'm so pleased to hear that there are payers on participating today, because your role is extremely important. And I think we'll see more and more payers and more models, reimbursement models, that take into account these social factors. And in this case, food insecurity, and making sure that there's funding available to maintain the missions of organizations like Food and Friends and Capital Area Food Bank, because they are part of the continuum of services that are needed to keep individuals and communities healthy.
Great. Thanks, Dr. King. As we transition to Carrie, I'll throw in a question from our audience as well, but I want you to talk about sort of the future, and this is a related question. any new cutting edge projects or thinking that that Food and Friends it's considering or thinking about.
Great. Okay. So, in thinking about the future, Chris, what you had to say about payers, and Radha, what you had to say about, investments to close gaps in access. One of the successes that Food and Friends has had this year, that we still have a long way to go, is with our fellow medically tailored meal agencies across the country. We've advocated for the funding of a Medicare pilot project to provide medically tailored meals, extend access to that in the Medicare system. So that's at the national level. At the same time that we're doing that, though, we also have to be working at the neighborhood level with the curbside groceries, at the household level with the home delivered meals. So it really does take doing everything at the same time to move the needle forward. In thinking about some of the cutting edge things that Food and Friends is thinking about, and just also, in the midst of where we're at with the COVID epidemic, one of the really heartbreaking things is that, before all this happened, we were really trying to learn more about social isolation and how that affects our client base, who a lot of times struggle to get out of the house and engage in their community. And this has really just made that much more important. And so, we're surveying all of our clients to find out what types of technologies they have access to, so we know where those gaps are. We're moving our nutrition education online to a large degree. We're doing nutrition education classes online this year instead of in person. So we really do need to be thinking more about that, because that's a pretty significant health issue also. There are a lot of health ramifications of being socially isolated. So, we're making some steps in doing things differently, and we're just really going to need to continue to think about ways to do that in the months to come.
Great, thanks, Carrie. So I'm going to turn to the questions very quickly. What are we doing to get lean quality protein to those who are food insecure? Calling and visiting the food banks, they often tell me that they're getting limited quality of fresh produce, and it often goes quickly, and they can only give what they get to donate. Is there a way to get more donations for healthier foods? Radha, I want to turn that question to you. Yeah, could you unmute, please? Yeah.
Sorry. So happy to answer that. In the past, yes, a lot of the food that we received was donated to us, and that's what we would, pass on, if you will. To be precise, 2/3 of the food prior to COVID was donated to us. That has all dramatically changed. We get very little in the form of donations now, and we're purchasing a ton of food. Our budget for the next year is 5-fold what it would have been on a normal year. We purchase about $3 to $3.5 million worth of food, usually produce and protein, which we don't have donated. And now we're purchasing $17 million worth of food this year for the coming year. So we are purchasing as much protein and produce. We take advantage of the local growing season here, and we purchase from farmers in the area, but that's coming to an end in the next month. But then we purchase from afar, as far as up in Canada to down south and west. So we will continue to do that. As I said, we always put out 35 to 40% of what we distribute is groceries, fresh produce rather. So that's what we will continue to do. We'll just be purchasing all of it. And from a protein perspective, yes, we offer plant-based protein as well as meat protein. And one of the issues there is storage. The need has grown. Our cooler and freezer are huge by many standards, but we need to get more there. So we're in partnership conversations with different manufacturers and retailers, and we've leased even more space in Prince George's County to be able to store this food and get it out to people. So it's an ongoing battle.
Thank you. So there's a question about the role of volunteers. Carrie, I'll throw it to you, and then back to Radha, and then Dr. King, I have a question in the queue for you. So could you just talk about the importance of volunteers for your organizations and the role they play in addressing food insecurity?
Absolutely. We are a volunteer-driven organization. We rely very heavily on our volunteers, both for the food preparation and food delivery. Pre-COVID, our volunteers, spent as many hours at Food and Friends as our staff did, right? So they really doubled our capacity to do this work. The work would be a lot more expensive without the volunteers, but it's also an opportunity to bring people together, which is more important now than ever, to take care of each other, take care of our neighbors, and do the right thing together. And that actually has a community benefit as well. We have a lot fewer volunteers here now just because of the spacing requirements that we all have to live by. So we definitely miss a lot of our friends, but the folks who are able to come in and be with us right now are both an encouragement to the staff, they're an encouragement to our clients. You know, they are still the person at the door who's there to check on you and make sure that you're okay. And they really are the core force behind our ability to do this work.
Yeah, I would agree with Carrie. It's such an important. Volunteers help our operations significantly. You know, we're down to 900 to 1,000 volunteers a month now, and it used to be 50 to 60% more than that. The additional step we have to take now is we're boxing so much of the food that we are providing so that it can be provided in a safe manner. And so we have gone from a five and a half day a week, 2 shifts a day, to 7 day a week, 3 shifts a day volunteer operation. So we are now open from 5 in the morning till 8, 9 at night, and 7 days a week, just to be able to keep up with this increased volume that I mentioned. 50 million meals worth versus 30 million meals, and just with the spacing that's required for volunteers, we can't have as many at the same time. So we've added the night shift, we've added the Sunday shifts, et cetera, to help keep the operation going. So thank you for everyone and anyone who's come out to support our organizations. It's so meaningful.
Thank you. Dr. King, can you talk about your thoughts on the intersection of health, healthy food access, and education, and what role can primary and secondary schools play as it relates to holistic health care?
Sure, thank you for that question. It's interesting that that's punted my way because I started my career as a high school health educator. Huh. So you're speaking my language.
Yes.
I think that, I think that we have to have a societal shift in how we think about food, right? I mean, again, if we can teach young people at the beginning, starting in preschool, that food is medicine, we can have a whole new generation of folks who are game changers, and their health status is so much better than what we're seeing right now. Mm-hmm. So I think that the primary, secondary schools have an extremely important role, and I'll be the first to say that we are missing the mark there when we cut physical education and we don't talk about and really integrate healthy eating in everything that we do throughout primary and secondary education. We're missing the mark. So there's certainly a role that the school system as a whole can play in a healthier America.
Carrie, are you engaged with partnerships with school systems, with schools?
Yeah, in a typical year we are. Obviously not this year with remote learning, but yeah, high schools, middle schools and colleges are all a really important part of our volunteer workforce in a typical year.
And Radha, I know that you are working closely with a number of school systems in the region around making sure that school-age kids have access to food. Do you want to speak to that very quickly? I'm trying to make sure that I ask the questions and get to them very, very quickly.
No, absolutely. We do. Many of our direct distribution programs are at elementary, middle, and high schools. They're not just food for kids, but also for the whole family. And I think what's really interesting now about some of our college and community college programs is we're trying to bundle together the skill development and the workforce development with food. So the point about going from minimum wage to a living wage, when you can get a higher degree or a higher certification, people tell us often that they don't end up staying in those programs because they have opportunities to make money on the side when those classes are taking place. So we're saying we'll provide you with free food for you and your family for that week or 2 weeks, as long as you stay in that program and receive the certification. So I think that's another way to show that link between food and not just health, but education, which will lead to stronger economies and living wage for the individuals.
All right, so we're down to our last few minutes. There's a question. I'll read the question, but also just create the opportunity for you to say a few closing remarks. And Carrie, you'll be you'll have the last word. But vis-a-vis the question. So most healthcare providers are still depending on fee-for-service payment models in order to sustain their business. What does a successful partnership with a healthcare provider look like in the current fee-for-service world that goes beyond pilots that are dependent on grant money that may run out? It's a pretty broad question, and Radha, I think you touched on it when
Sure.
when you opened
Yeah.
the session. So I don't know if you'd like to just to speak
Sure.
to it, you probably
Yeah, happy
can.
to.
But you can also think about it in the context of your closing remarks and as we wind down the session.
Great. Thank you, Tonia. You know, I think it's going to behoove all of us to think very creatively about these partnerships. There isn't necessarily a cookie cutter type of approach that we can go to say this is how it's going to work, you know, between the healthcare institution, you know, the nonprofit provider and the client. But there are lots of good ideas that we all have, you know, on how to make this work. And a very quick answer, you know, and it's a simple one to this question, which deserves a more complex one, is just that, you know, there's support that can be provided in terms of funding from the insurance company or the healthcare provider to the NGO that is providing that good, nutritious food. And we will be able to calculate a return on that investment that will show over time how that initial investment pales in comparison to, you know, the fact that there aren't bigger claims and bigger expenses downstream, if you will. So I think that's just one way that we can look at that. And just in closing, I'm just so thrilled that Carrie and Food and Friends hosted this panel, because this combination of food, you know, health, equity, and economic growth, you know, is such an important topic. You know, some of us have understood those linkages, and we've been sort of struggling to shine the spotlight on it. In a bizarre way, COVID is allowing us to shine the spotlight on this issue. And what I hope is that we can accelerate our engagement towards addressing these issues in a much more integrated way. So instead of saying it's a wasted year and it's been a difficult year, which it has, but you know, we can actually move from this and with a lot more attention to these issues. So as our region looks to recover and rebuild, let's think about all of these interconnections and who we need to bring to the table to ensure that we're reducing that equity gap, whether it's from a racial perspective and a health perspective or an economic perspective.
Thank you, Radha, and thank you for all the work that you do every day on behalf of the community, the Greater Washington community. Dr. King, last words from you.
Yeah, I just want to say how much respect I have for these two organizations and how honored I am to be on a panel with these leaders. I am thinking about COVID right now and the impact that COVID has had on residents of our region, our own neighbors, and the importance of ensuring that they have access to high quality, healthy foods. And these two organizations are right here and ready and are mobilized to do meaningful work. But it does go to show the importance of food, right? And how vulnerable people are. I'm looking at school systems and thinking about how parents want to send their kids or need to send their kids to school just so they can eat. And this is America, right? This is America. We should not be in the place that we're in right now. So we have our work to do. I think it's all sectors will need to show up and do some heavy lifting. My space is in the healthcare space, and there's so many others who are in this space who are really pushing for a new healthcare experience that takes into account each individual as a whole person and not just a biological being, right? We are complex beings with all types of things that are impacting our health and well-being, and food is key. So thank you for the invitation, and I look forward to continuing these partnerships and improving the health of the region through good food.
Great. Thank you, Dr. King. Thanks for your amazing work as well. Carrie, last words, over to you, Food and Friends.
Yeah, thank you. You know, I agree with my fellow panelists. You know, all of these inequities and issues that we've been talking about, we knew that they were there, we were working on them. So let's take advantage of this microphone moment that we have, all of the additional attention that is being placed on the issues that we're dealing with, to make new partnerships, you know, across all sectors. And I really do think that if anybody can get this right, DC can get this right. You know, we've got great organizations, we have a lot of resources here, we have leadership. Let's work together to create new partnerships and new programs and solve these problems.
Absolutely. Carrie, I agree with you wholeheartedly. If there's any place in the country where we can work collaboratively, it has to be here in the greater Washington region. We have the brightest minds, the best research, and access to capital and other resources that we need. We just really need to organize ourselves and continue to do the important work that both of you, all of you, are already doing. I want to thank you all again for joining us today, the audience, and many thanks again to the panel and for Food and Friends for organizing this important conversation. All the best, everyone, and have a great day.